Dear students, good evening. I welcome you all for the Nurses Academy YouTube channel. So, today we're going to see about neurological examination. So, first of all, I need to explain what is neurological examination. See, I hope that you all know about physical examination, right? See, the neurological examination means you are going to assess the person, the person one who have a neurological deficit. So, the person who is having a neurological deficit, for them you are going to do an assessment. It's called as a neurological examination. So, we'll see the components of neurological examination. So, first one, level of consciousness. You have to assess the consciousness, level of consciousness. Then second one is a mental status examination, and you have to assess the cerebral functions of the patients, then cranial nerve function, then motor function, sensory function and cerebellar function, then reflexes. So these are the components which are included in the neurological examination. I'll explain one by one how you have to do an assessment. Okay, so first we'll see about level of consciousness. How you should assess the conscious level of the patient. See, while you are going for the clinical posting, see if you have seen any neurological patients, then you have to assess the consciousness of the patient. See how you can assess the consciousness means if the person is maybe in the alert. Alert means when you will say the person is alert. Alert means the person is responding spontaneously. If you are talking with a person, they are given the answer appropriately and they have given the spontaneous response. Maybe the eye open is spontaneous and verbal response is clear verbal response, and they know about time, place, they are well oriented, then it's called as the person. If the person is given the spontaneous response, then the person maybe comes under alertness. There is no any problem because their GCS level is up to 15 and they are is alert. Okay, and next one is lethargic. See, lethargic means the person may be in a drowsy state. What is meant by drowsy? They look like drowsiness, but sometimes the person is having a consciousness, but even they couldn't tell the answer, right? So sometimes the person may be in a slurred speech, like that they will be having. So if the person may be in a lethargic state, a drowsy state, then it's called as a lethargic. If the person is given the spontaneous response, then it's called as alertness. If the person maybe looks like very drowsy, then it's called as lethargic state. Then next one is a stupors. See, stupors means maybe the person they are responding your commands, though they are having a very difficulty to respond. Actually, the person is responding. If you are asking something, open your eyes, like that. If you are commanding, the person doing the response, the person is responding your commands with great difficulty. They are having a lot of difficulty do the activity. That's called as a stupors. The person aroused with the difficulty, great difficulty, is called a stupor. Then semi-comatose. So semi-comatose means the person cannot able to do the things, which means he has a loss of ability to do the things. This is called as a semi-comatose. Here the person is doing the response, which means they are responding your commands with great difficulty. Here they cannot able to respond. That is called a semi-comatose. Next one is a comatose. Comatose means never response. He will not give any response. No response in sense, it's comatose stage. Clear? See, alertness means spontaneous response. Then lethargic, the person looks like a drowsy. Then stupors, he is responding with a great difficulty. Then semi-comatose, he cannot able to give response. The person can't able to the person cannot able to do responding. Okay. Then next one is a comatose. Comatose means no response. Okay. Here the semi-comatose, the person loss of his ability. He lost his ability to respond. But coma, no response. Clear? So these are the things. With this information, you have to assess the level of consciousness. So you have to assess the patient level of consciousness according to the which means according to the level you have to give the answer. Either the patient may be alertness or lethargic, stupors, semi-coma or coma. Which state the patient is this, that state you have to mention in your neurological examination. Clear? Then next we'll see about mental status examination. See, in mental status examination in your mental health nursing, you'll be completely studying about mental status examination. Here you just see how the person is responding, maybe the orientation, how their speech, how they have given the response through verbal. Okay, so you have to assess the speech level, you have to assess the cognitive function, which means you have to assess the skillful activity, and you have to assess the judgment, which means you should communicate with the patient how their understanding capacity and how their orientation level about the time, place, environment, that. And which means if you ask something like when is your date of birth, and are you married or unmarried, what is your mother name, father's name, like that, you should ask some skillful questions. If they are responding well, then it will be okay. Otherwise, the person may have a decreased mental status examination, which means decreased ability. So that you have to mention. Clear? Then next we'll go for a special cerebral function. See, in the special cerebral function, you need to assess three things, which means first one is agnosia. Second one apraxia, third one aphasia. So these three things you have to monitor while doing a cerebral function. See, in the cerebral function, you have to monitor agnosia, apraxia and aphasia. I'll explain one by one. Agnosia. Agnosia means the person cannot able to recognize a common object through sense. Do you understand? See, the person cannot able to recognize the common object through the sense, which means if you are showing a pen to the person, they can't able to answer because it's a common object. Due to their sense of ability, due to a deficit of sense ability, which means they have a loss of sensation. Like, what are the sensation? We have a vision, hearing, right? So we can see the object, we can hear the sound, and we can feel the touch, right? No, so these are the things is a sensory object. So due to a sensory object deficit in the brain, the person cannot able to recognize the objects. Clear? Through the sense, if they are looking the object, even though they cannot able to say, which means the common object and all they couldn't say. That is called as agnosia. Next one is apraxia. Apraxia means I'll give some examples. Apraxia in the sense they cannot able to do a skillful activity without paralysis. They cannot able to do a skillful activity without paralysis, which means the person don't have any paralysis. Even though if you have commanding, move your leg, raise your hands, like that, if you are commanding, they couldn't do because they are having a cerebral deficit. In the cerebral brain, they are having a deficit. That's why they couldn't do these activities. Okay, see, agnosia means they couldn't able to answer, which means they couldn't able to answer, recognize a common object through the sense. In the apraxia means they cannot able to do a skillful activity without paralysis. And next one, aphasia. Aphasia means inability to communicate. That is called as aphasia. I hope you all are understood about cerebral function, right? See, in the level of consciousness, you have to assess 5 things: alertness, lethargic, stupor, semi-coma, coma. And you have to assess which state the patient is this. According to that you have to write. Then you have to check the mental status level of the patient. So you have to communicate with the patient. You should assess the orientation level of the patient, cognitive functions of the patient, and you have to assess the judgment, thinking level, then speech level. Like that you should assess. Accordingly you have to write your answer. Then next you should go for a cerebral function. In the cerebral function you need to assess three things. So first you have to assess agnosia. How you have to assess the agnosia? You have to show some common object to the person. If they are recognizing, then it will be okay. If they couldn't able to, which means they can't able to recognize, then the person may have agnosia. Then apraxia. Apraxia means how you can assess the apraxia. Ask the person to do some skillful activity. Like you just give the commands to, which means raise your hands, move your legs, like that you should give some commands. So if they can't able to do, even though the person don't have any paralysis, even though they cannot able to do the activity, then the person is having apraxia. Then next one is aphasia. You have to communicate. Till now already you people will you maybe you are the investigator, so you are communicating with the patient. If they are communicating well, then aphasia is absent. So you have to monitor these three things in the cerebral function. So if they don't have any deficit on these three, then you may just write it agnosia absent, apraxia absent, aphasia absent. If it is anything is present, then you can write it accordingly. Clear? Till now we have seen how you have to assess the level of consciousness and how you have to assess the mental status examination and how you should assess the cerebral function. So remaining things in the next video we will just clearly explain about cranial nerve examination. Okay, thank you all. See you. Bye bye.